Albuterol, trade name Proventilin, Ventolin. Classification, bronchodilator and beta agonist. Mechanism of action, binds and stimulates beta-2 receptors resulting in relaxation of bronchial smooth muscle. Indications, asthma, bronchitis, emphysema, crush injury with hypokalemia. Contraindications, angioedema, sensitivity to albuterol or levobuterol, caution with lactating patients, cardiovascular disorders, and cardiac arrhythmias. Dose, metered-dose inhaler, 4 to 8 puffs every 1 to 4 hours. Nebulizer, 2.5 milligrams to 5 milligrams every 20 minutes for a max of 3 doses. After 3, escalate the dose or start nebulizing at 10 to 15 milligrams per hour. Peds dose, metered dose inhaler, 4 years old, 2 inhalations every 4 to 6 hours, younger than 4 years old, administered by nebulizer. Older than 12 years old, continuous nebulizer, 0.5 milligrams per kilogram per hour. Younger than 12 years old, 0.63 milligrams to 2.5 milligrams every 20 minutes for max dose or nebulize at 0.5 milligrams per kilogram per hour. Side effects, hyperglycemia, hyperkalemia, palpitations, sinus tachycardia, anxiety, tremors, nausea, vomiting, throat irritation, dry mouth, hypertension, dyspnea, insomnia, headache, epistaxis, pericardial bronchospasm. Special considerations, pregnancy class C. Xopenex, trade name, levobuterol. Classification, beta agonist. Mechanism of action, stimulates beta-2 receptors resulting in relaxation of the smooth muscle in the lungs, uterus, and vasculature that supply skeletal muscle. Indications, asthma, COPD, rhinorrhea, and rhinitis. Special considerations, pregnancy class C. Combivent, trade name, Albuterol, Ipratropium. Classification, combination bronchodilator. Mechanism of action, binds and stimulates beta-2 receptors resulting in relaxation of bronchial smooth muscle and antagonizes the acetylcholine receptor producing bronchodilation. Indications, second-line treatment in COPD or severe acute asthma exacerbations during medical transport. Contraindications, allergies to soybeans or peanuts, known sensitivity to atropine, albuterol, or derivative. Caution with patients with asthma, hypertension, angina, cardiac arrhythmias, tachycardia, cardiovascular disease, congenital long QT syndrome, closed angle glaucoma. Dose, metered dose inhaler, 8 puffs every 20 minutes for up to 3 doses. Nebulization, 3 milliliters every 20 minutes for 3 doses, then as needed. Side effects, headache, cough, nausea, arrhythmias, pericardial acute bronchospasms. Special considerations, pregnancy class C. Methylprednisolone, trade name, Solu-Medrol. Classification, corticosteroid. Mechanism of action, reduces inflammation by multiple mechanisms. Indications, anaphylaxis, asthma, COPD. Contraindications, Cushing syndrome, fungal infection, measles, varicella, sensitivity, caution with active infections, renal disease, penetrating spinal cord injuries, hypertension, seizures, and CHF. Dose, asthma and COPD, 40 to 80 milligrams a day IV divided into 2 dose. Peds, 1 milligram up to 60 milligrams IV, IO per day in 2 divided doses. Anaphylactic shock, 0.5 to 1 milligrams per kilogram IV every 12 hours. Peds, same as adults. Side effects, depression, euphoria, headache, restlessness, hypertension, bradycardia, nausea, vomiting, swelling, diarrhea, weakness, fluid retention, and peritonitis. Special considerations, may mask signs and symptoms of infection, pregnancy class C. Hydrocortisone sodium succinate. Trade name, Cortef Solucortef. Classification, corticosteroid. Mechanism of action, Reduces inflammation by multiple mechanisms. As a steroid, it replaces the steroids that are locking in adrenal insufficiency. Indications: adrenal insufficiency, allergic reaction, anaphylaxis, asthma, COPD. Special considerations: pregnancy, class C. Ipratropium bromide, trade name, Atrovent. Classification: antiochlorogenic bronchodilator. Mechanism of action: antagonizes the acetylcholine receptor on bronchial smooth muscle, producing bronchodilation. Indications: asthma, bronchospasms associated with COPD. Contraindications: closed angled glaucoma, bladder neck obstruction, prostatic hypertrophy, known sensitivity including peanuts or soybeans, and atropine or atropine derivatives. Dose: meter dose inhaler, 8 puffs every 20 minutes for up to 3 hours. Peds dose: older than 12, 4 to 8 puffs every 20 minutes for up to 3 hours. Nebulization: 0.5 milligrams every 20 minutes for 3 doses, then as needed. Peds 5 to 14, 0.25 milligrams to 0.5 milligrams every 20 minutes for 3 doses, then as needed. Side effects: cough, hoarse, extubation, epistaxis, dry secretions, headache. Special considerations: administered after a beta agonist. Do not let come in contact with eyes in pregnancy, class B. Amiodarone, trade name, Cordone. Classification: antiarrhythmic. Mechanism of action: prolongs acute potential and refractory period without affecting resting membrane potential. Indications: reoccurring VFib, pulseless VTAC, unstable VTAC, and unstable SVT. Special considerations: pregnancy, class D. Magnesium sulfate. Classification: electrolyte, tocolytic mineral. Mechanism of action: required for normal physiological function. Magnesium is a core factor in neurochemical transmission and muscular excitability. Magnesium sulfate controls seizures by blocking peripheral neuromuscular transmissions. Magnesium is also a peripheral vasodilator and an inhibitor of platelet function. Indications: refact VFib and VTAC in hypomagnesia, seizures and eclampsia, torsades de pointes, asthma possibility. Contraindications: AV block, GI obstruction, caution with renal impairment. Dose: cardiac arrest and wide complex tachycardia, 2 milligrams IM, 10 milliliters normal saline IV. Asthma, 2 grams IM, 10 milliliters normal saline over 10 to 20 minutes with running saline. Seizures and eclampsia, 4 grams IM, 20 milliliters over 10 to 20 minutes with running saline. Side effects: magnesium toxicity. Signs include flushing, diaphoresis, hypotension, muscular paralysis, weakness, hypothermia, and cardiac, CNS, or respiratory depression. Special considerations: pregnancy, class C. Racemic epinephrine. Classification: bronchodilator, adrenergic agent. Mechanism of action: stimulates both alpha and beta receptors, causing vasoconstriction, reduce mucosa edema, and bronchodilation. Indications: bronchial asthma and croup. Special considerations: monitor blood pressure, heart rate, and cardiac rhythm for changes. Onset of action is 1 to 5 minutes. Effects may persist for 1 to 3 hours. Pregnancy, class C.